Hello class, this is Mrs. Alston. This is a typical cervical vertebra, so I just want to go over some of the anatomy with you. The two main parts of a vertebra is the body, which is right here, and the arch, which is this right here. Now the cervical vertebra has some unique characteristics to it. It has a transverse foramen, this opening right here, which allows for nerves and blood vessels to travel through from the spinal cord. It also has a bifid tip on the spinous process. So if you note here, the spinous process isn't just one elongated area, it divides into two separate parts. Now, what attaches the arch to the body is the pedicle, which is right here on both sides of the vertebra. And then the area that connects the transverse process, which is right here, remember the transverse process has the transverse foramen, is the lamina. Okay, so right here between the transverse process and the spinous process, this bridge is called the lamina. Now I'm going to pick this vertebra up and put it on its side here so that you can see it. Now here, this area right here is known as the superior articular process. So this little ear looking thing right up here, that's the superior articular process. And the part down here that looks like a leg is the inferior vertebral process. And then the column between those two are known as the articular process or the articular pillar. And then on C1, that is the lateral mass. Now the foramen that you have that is the opening between the body, between the body and the arch is the vertebral foramen, and that's where the spinal cord traverses through. So the characteristics of a typical cervical spine are they're going to be the bifid tips, they're going to have the transverse foramen.